Hello and welcome to our EKG workshop, session 1, introduction. So what's EKG? Recording the electrical activity of the heart. Let's look at a normal EKG pattern. We see waves, segments, and intervals. The P wave is the atrial depolarization. The QRS complex, or the QRS wave, is the ventricular depolarization, and then the T wave is the ventricular repolarization. What happened to atrial repolarization? We can't see that because it is embedded in the other waves. So what's the difference between a segment and an interval? A segment is just a segment. It doesn't include any waves. So when we say PR segment, it is without the P wave. It's just a segment between the P wave and the R wave. And when we talk about the PR interval, we mean the P wave plus the PR segment. So what are the other waves that we might be able to see in normal subjects? For example, a U wave is something that in some normal subjects you can see it. However, it is for the most part a sign of low potassium or hypokalemia. So let's look at the P wave changes. The P wave can be big, the height can be more than normal, and if it passes half of a big box, which is more than 2.5 millimeters, then we call it P pulmonale, which is a sign of right atrial hypertrophy. So if you look carefully here, you see in EKG small boxes and big boxes. So 5 small boxes will be 1 big box. So each small box is 1 millimeter and a big box is 5 millimeters. So when you look at some EKG pattern and you just see that the height of the P wave is more than half of the big box, then you can think about P pulmonale. Now let's talk about P mitrale. This is just a notched P wave. So this is a sign of left atrial hypertrophy. Now we look at the Q wave. The Q wave is less than 1 small box when we think about the duration. So the x-axis shows the time, the duration, and a small box, 1 millimeter, is actually 0.04 seconds. So if a Q wave is bigger than that, it could be pathologic, and it is usually a sign of transmural infarction. But it's a late sign. Then we look at the T wave. An inverted T wave is a sign of ischemia or myocardial infarction in some cases. The segments and intervals. So let's look at the PR interval. The PR interval is a sign of AV node delay. If it is prolonged, then you have first degree heart block as one of your differentials. Then we look at the QT interval. This is both ventricular depolarization and repolarization. The QT interval is important because when we use antipsychotic and antiarrhythmic medication and even some other drugs, they can prolong the QT interval, and we have to measure it because a prolonged QT interval can cause dangerous tachycardia, ventricular tachycardia, especially torsade. Then we look at the ST segment changes. So ST elevation could be a sign of myocardial infarction, and ST depression could be a sign of myocardial ischemia. How do we evaluate ventricular hypertrophy? So for left ventricular hypertrophy, we look at V1 and we measure the S wave, and then we look at the V5 or V6 and we measure the R wave, and we add them up. If it is more than 35 millimeters, then we have left ventricular hypertrophy. In the case of right ventricular hypertrophy, we look at V1 And if the R wave in V1 is more than 7 millimeters, then we have right ventricular hypertrophy. There are different methods for doing this. This is one of them. Thank you for your attention, and we'll see you next time.